Vascular surgery is a relatively small specialty, but it deals with the blood vessels essentially. So blood vessels bring blood flow to every organ in your body. The heart pumps the blood, it goes to the brain, from the brain to the toes, all of the organs in the body, and we, as vascular surgeons, treat all of those blood vessels, keeping blood flow going to all of these locations, and also treating other problems with the blood vessels. That would include atherosclerosis and narrowing, but also things called aneurysms, which is an enlargement of the blood vessel. No, it's very different depending on the type of problem that the patient is facing. And add to that the fact that technology is changing pretty significantly, and so the types of procedures we do evolve with technology to allow patients to have new procedures that may be a more effective treatment for them. So we do a fair amount of things related to strokes, and that's part of a spectrum of diseases with atherosclerosis as the main cause. And so a blockage or narrowing in the artery can cause a stroke, but it can cause other problems like loss of blood flow to the legs. So historically, and even today, some of the most effective treatments are open surgery, meaning either doing a bypass around a blockage or actually opening up the artery, cleaning it out, and closing it back up again. And that's one of the most common treatments for stroke prevention, is something called an endarterectomy, which is the removal of plaque from the artery. Obviously, safety and a durable patient benefit are the two key things, meaning that we want to get a good result at the time of surgery, have the patient recover well from the surgery, but also experience a long-term benefit from the surgery. In vascular surgery, I think the future is really in less invasive procedures, providing a good benefit to the patient, a fast recovery, and an excellent result. And more we're moving towards less invasive procedures that are custom tailored to the patient's specific needs and even their specific anatomy, meaning that patients don't all have the same blood vessels in the same places. So we try with a lot of the innovative technology available to create a treatment strategy, a less invasive treatment strategy that is tailored to the patient's specific needs. So Northwestern is exactly that, highly innovative. We treat a very complex group of patients, and that's one of the things that's very exciting to me, is that we can offer patients this broad spectrum of disease treatment, from medications and innovative strategies related to gene therapy and stem cell therapy. We can offer less invasive therapies to patients who have very complex diseases, and many patients who in other circumstances and in the past would have not been candidates for any surgical procedure, meaning that they would have just lived with their disease and we wouldn't have anything to offer them. Now that's changed. It's changed remarkably. And we can now offer patients tailored therapy that is less invasive. We can also offer patients a type of therapy that may be experimental and may, instead of being surgery, be an injection that will treat their blockages in the arteries, and a medication that will treat those blockages. So as we've been talking about, technology is evolving rapidly in vascular surgery and a lot of specialties. But particularly for vascular surgery, we're able to treat a lot of problems that have historically been treated with major open surgical procedures, with less invasive procedures that can offer patients a fast recovery, a good result, and even a durable result.